Hi, everybody. My name is Dr. Katie Baker, and I am one of the co-authors of the Introduction to Healthcare Professions textbook for SBCTC. I'm going to be walking you through Chapter 3, which is about social determinants of health. We're going to start the chapter with a brief overview, a little vignette about a girl who lives in the city and all of the experiences that she has that influences her health. And we're going to talk about those experiences and factors in detail in this chapter. So we're going to cover these objectives. And one of the things I like about the objectives is I like to incorporate them into any activities that are involving the chapter. And I also like to link them to course learning outcomes or course learning objectives so that students can see how learning this information is going to help them be successful in the class. Okay, when we get into the next section, key terms, this is really great for like a brief quiz, creating any sort of student flashcards or other small activities that can help them learn to speak the professional language of healthcare. So let's go ahead and continue on to our next section here. So first, we're going to talk about Healthy People 2030. Healthy People 2030 is a U.S. federal program that looks at social determinants of health. And what we could do for this is we could discuss Healthy People 2030, talk about the ways in which government organizations are trying to address these social determinants of health through public health initiatives. And also, it might be worth looking at historically Healthy People 2020 or Healthy People 2000 to see where we've come in the last 10 to 30 years in terms of the public health goals from the Center of Disease Control and Prevention, or CDC. We're talking about things like economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, which also looks at, environmental exposures, social and community context, and then goals moving forward with Healthy 2030. So when we talk about social determinants of health, one of the primary things we want our students to understand is health literacy. So what is health as opposed to absence of illness? What are the social determinants of health, and how can personal choices affect our health? So we're going to talk about personal and family choices. We're going to talk about religious norms and the impact of religion on healthcare. Not only the positives, but also some of the negatives of family and religious influences. We're going to talk about the environment that we exist in, both in our homes, in our school, and at our job, and how those environments can have an effect on us through physical, chemical, or environmental exposures, as well as providing opportunities for access to nature, access to recreation, and job advancement. So there's a lot kind of going on in here. With this chapter, I did try to provide updated information as much as possible. So there's a lot of discussion about COVID-19 in this chapter and how the pandemic affects our social determinants of health, as well as how public health intervened to help minimize any effects of the pandemic. We've got society and culture. Society and culture is mainly the norms, but also the institutions that are part of our culture here in the United States. And in the next section, we're going to start talking about public health, but I want to point out that there are some really brief check-in kind of multiple choice questions that are throughout the chapter that can help students check their knowledge. Okay, so there's 4 of them here in this section. And let's talk about public health next. So in the public health segment, we're going to be talking about the history of public health. We're going to talk about the present day interventions that public health does. We'll talk about primary, secondary, and tertiary interventions. We're going to talk about funding. So if funding comes from local, state, and federal sources, how does politics influence the funding of public health programs? In this chapter segment, we will talk specifically about Washington State, but we'll also talk about federal organizations and public health funding, such as an example of HIV/AIDS research that was limited in the 1980s. And sex education, because sex education is something that interests students. Many of them come from different backgrounds with varying amounts of sex education. And I think that it's important for them to see some statistics about abstinence-only sex education versus reducing risk sex education. Right? And gun control. They're trying to hit some really hot topic subjects that would be interesting to stimulate small group discussions in class. So in class, one of the things that we can look at is having peer teaching, where we can divide up the chapter and the students can teach their peers what they've learned from that chapter with a brief summary and maybe some questions and answers. Small group discussions might include things like, what are examples of social determinants of health? Who is affected the most by those social determinants of health? What's the cost of those effects? What's the current role of the government in addressing social determinants? How does prevention play a role in public health? So you might say something like, hey, name 3 ways in which prevention addresses social determinants of health. And we might ask, what role can healthcare providers play in supporting improvements to social determinants of health? These are all great questions for essays. They're great questions for like minute writing or small group discussion. Okay, we're going to talk briefly about epidemiology and what it means to actually be an epidemiologist. We're going to talk about 10 essential public health services that the CDC put together, which talks about basically 10 ways in which the community can maintain strong public health. So these would also be an opportunity for you to discuss professions that might address these 10 specific items. Okay, so public health and disease prevention includes looking at primary, secondary, and tertiary interventions. And then we're going to enter into the skill stitch. The skill stitch for this chapter is about advocacy. So many times our healthcare providers become advocates for their patients, either at a state or federal level, maybe by protesting or maybe by testifying on behalf of a bill, or locally by working in the clinic to advocate for patients and making sure that their needs are met. The example in the skill stitch is a transgendered female patient who may also be having some financial issues. So there's some questions that students can reflect upon in terms of how they could be an ally and an advocate for this patient of theirs. Okay, then we got some true false questions, a few more knowledge checks, and we're on to the next section, which is racism and its effects on health. Now, clearly, there are many books written on this knowledge. So what I tried to do was I tried to bring the basic foundational information in that might encourage students to go on and look at things on their own, but it's just enough, I think, to kind of lay the groundwork with some historical information and some scientific information. So we know that race is not a biological concept. We know that race is a social concept and has very real repercussions. But We also know that there is no genetic basis for that. So this is one of the things that I incorporate into my biology courses when we talk about genetics, is that there is no variation between two groups that is greater than the variation within the groups themselves. And I discuss in those classes more research about how that's been proven. Now, we're going to have just a brief bit of information about historical racism and institutional racism in the United States, including some things like the 13th Amendment, the Chinese Exclusion Act, and slavery since before colonization. We're also going to talk about the variations that we see in mortality and morbidity rates between white patient populations and Black, Indigenous, and people of color populations. So the thing that I want to really stress at this point here is the amount of references and resources that we have to support this section, which are all in the back of the text. And I think that it's really important for students to see how other students are interacting with the idea of racial inequities in healthcare. So we start with the discussion about the University of Virginia medical school system and how they had believed some myths about medical differences between Black and white patients. And then we talk about how the University of Washington is causing some changes to occur. So there's some statistics in here about treatment algorithms that are racialized, as well as social determinants of health and how they affect people differently depending upon their background. And when we get into our section on developing measures to overcome health disparities due to racism, this is where we get to the good news. And I think that this is a really nice section to kind of end a discussion on, which is talking about how the University of Washington School of Medicine looked at racialized differences in basically the testing for kidney function. And the standard testing for kidney function had a different formula for patients who were African or African American. Once they removed that variation and they tested everyone with the same formula, the number of African American patients who were placed on the transplant list would have increased by 30%, and those patients would have qualified for higher level disease treatment than if they were still using the formula with the racial coefficient. So the University of Washington, major medical centers throughout the South, and Cedars-Sinai Hospital in LA has all shifted to a different kidney function test that does not include a racial coefficient. The key, I think, here is that it's important to underline for the students is that this was driven by student pressure. This was not something that a research scientist or someone who's been teaching for 40 years was pushing back on. This is something that our students themselves were actually doing. So I think that that's really important to look at student-led reform and things that have changed since the pandemic when we're looking at our social determinants of health. Okay, now we'll wrap up with our chapter conclusion, which of course we have a summary in every chapter. And then we'll have review questions. Now, these review questions could be used in the class or they could be used as homework questions, but they're a great opportunity to make sure that the students are reading and comprehending the material. That's it. If you're interested in the references, you can see that at the very end, we'll have so many references. So if students want to learn more about social determinants of health, they want to learn more about racism and its effects on healthcare, these are some really good, very approachable references. Thanks so much for watching, and I hope you get a chance to use the text.